prediction of the future, though, has a lot of variables in it that, you know, as the last panel argued, are there unintentional, unintended consequences of the law? History proves there will be. There have been, there will be. And so by definition, they're difficult to predict what impact the law and the changes are going to have on the current losses. Underlying that are the actual injuries, what we should care most about, which is the injured worker and how we're going to get them treatment and get them back to work. The difficulty in predicting that component of it is healthcare reform, candidly. And I really, it's an interesting day or 2 days to use that phrase because everybody wants to get on what side of the aisle they're on. And I would argue it doesn't make any difference. Healthcare is going to change in the United States. It's going to change whether the law stays intact. It's going to change whether it gets funded or stays funded, and it's going to change whether or not it gets repealed. The momentum has already begun. So how we access healthcare, how reimbursements occur, how quality is measured in the healthcare system generally is going to change. The question is whether we in the work comp environment use that change to find opportunities to improve the delivery of healthcare to our small component of injured workers. And I'm very optimistic that that's going to be a positive part of the equation, that I think there are opportunities there for us to do something better and different to improve the healthcare delivery to the injured workers. What the effect of the law is on that ability is a little more difficult to measure.